Lower extremity muscles. Sartorius. The origin is the anterior superior iliac spine. ASIS. The insertion is the upper medial shaft of the tibia, or pes anserine. 5 actions. It assists flexion. It also does abduction, as well as lateral rotation of the femur. It also assists in flexion of the knee. And lastly, it assists in medial rotation of the tibia when the knee is flexed and foot is unweighted. The nerve is femoral L2 and 3. Iliopsoas, psoas major, and iliacus. 2 origins include lumbar vertebrae T12 through L5, as well as the inner surface of the ilium. The insertion is the lesser trochanter of the femur. 2 actions include flexion of the femur as well as flexion of the trunk. The nerve is spinal L2 and 3. Rectus femoris. The origin is the anterior inferior iliac spine, AIIS. 2 insertions include the patella as well as the tibial tuberosity via the patellar ligament. 2 actions include extension of the knee, and it also assists flexion of the femur. The nerve is femoral L2, 3, and 4. Vastus medialis. The origin is the linea aspera, posterior medial femur. 2 insertions include the patella and the tibial tuberosity via the patellar ligament. The action is extension of the knee, and the nerve is femoral L2, 3, and 4. Vastus lateralis. The origin is the linea aspera, posterior lateral femur. 2 insertions include the patella as well as the tibial tuberosity via the patellar ligament. The action is extension of the knee, and the nerve is femoral L2, 3, and 4. Vastus intermedius. The origin is the anterior and lateral femoral shaft. 2 insertions include the patella as well as the tibial tuberosity via the patellar ligament. Action is extension of the knee. The nerve is femoral L2, 3, and 4. Pectineus. The origin is the anterior pubis. The insertion is the pectineal line of the femur, inferior to the lesser trochanter. 3 actions include flexion of the femur, adduction of the femur, and it also assists medial rotation of the femur. The nerve is femoral L2 and 3. Adductor longus. The origin is the anterior pubis. The insertion is the linea aspera of femur. 2 actions include adduction, and it also assists in flexion of the femur. The nerve is obturator L2, 3, and 4. Adductor brevis. The origin is the anterior pubis. The insertion is the linea aspera of the femur. And 2 actions include adduction, and it also assists in flexion of the femur. The nerve is obturator L2, 3, and 4. Adductor magnus. 3 origins: the anterior head, the inferior ramus of the pubis, the posterior heads, the ischial tuberosity, as well as the ramus of the ischium. 2 insertions: the anterior head, the linea aspera of the femur, and the posterior head, the adductor tubercle of the femur. 3 actions include adduction of the femur. The anterior head assists flexion and medial rotation of the femur, and the posterior head assists extension and lateral rotation of the femur. 2 nerves, the anterior head, obturator L2, 3, and 4. The posterior head, the nerve is sciatic L4. Gracilis. The origin is the inferior ramus of anterior pubis. The insertion is the medial proximal tibia and upper medial shaft of tibia, or pes anserine. 3 actions include adduction of the femur, assist flexion of the knee, and it also assists medial rotation of the tibia when the knee is flexed. The nerve is obturator L2 and 3. Gluteus maximus. 2 origins include the posterior sacrum as well as the ilium. 2 insertions include the gluteal tuberosity of the femur as well as the iliotibial tract, attaching to the lateral condyle of the tibia. 2 actions include extension of femur as well as lateral rotation of extended hip. The nerve is inferior gluteal L5, S1, and 2. Gluteus medius. 2 origins include the ilium as well as the iliac crest of the ilium. The insertion is the greater trochanter of the femur. 2 actions include abduction of the femur, that's abduction. Also, the anterior fibers do medial rotation of the femur. The nerve is superior gluteal L5 and S1. Gluteus minimus. The origin is the posterior ilium. The insertion is the anterior surface of the greater trochanter of the femur. 2 actions include abduction as well as medial rotation of the femur. The nerve is superior gluteal L5 and S1. Tensor fascia lata. The origin is the iliac crest of the ilium. The insertion is the iliotibial tract attaching to the lateral condyle of the tibia. 5 actions. It assists flexion. It does abduction as well as medial rotation of the femur. It assists stability of the knee in standing ambulation, and it also assists in extension of the knee. The nerve is superior gluteal L5 and S1. 6 deep lateral rotators. Piriformis. The origin is the anterior sacrum. The insertion is the greater trochanter of the femur, and the action is lateral rotation of the femur. The nerves, sacral plexus L3, 4, 5, and S1 and 2. Biceps femoris. 2 origins, the long head, the ischial tuberosity. The short head, the linea aspera. 2 insertions include the head of the fibula as well as the lateral condyle of the tibia. 3 actions include flexion of the knee, both heads, lateral rotation of the tibia when the knee is flexed, both heads, and the long head does extension of the femur. The nerves, the long head, sciatic tibial division L5, S1, and 2. The short head, sciatic fibular or peroneal division L5, S1, and 2. Semitendinosus. The origin is the ischial tuberosity. The insertion is the anterior proximal tibial shaft or pes anserine. 3 actions include extension of the femur, flexion of the knee, as well as medial rotation of the tibia when the knee is flexed. The nerve is sciatic tibial division, L5, S1, and 2. Semimembranosus. The origin is the ischial tuberosity. The insertion is the posterior medial tibial condyle. And 3 actions include extension of the femur, flexion of the knee, as well as medial rotation of the tibia when the knee is flexed. The nerve is sciatic tibial division, L5, S1, and 2. Tibialis anterior. 2 origins include the lateral condyle of the tibia, as well as the lateral shaft of the tibia. 2 insertions include the base of the first metatarsal on the plantar surface, as well as the medial cuneiform tarsal bone on the plantar surface. 2 actions include dorsiflexion of the ankle and inversion of the foot. The nerve is deep fibular or perineal, L4 and 5. Extensor digitorum longus. 2 origins include the lateral condyle of the tibia, as well as the proximal 2/3 of the anterior shaft of the fibula. The insertion is the middle and distal phalanges of 4 lateral toes. 2 actions include extension of 4 lateral toes at MP joint, and it also assists in dorsiflexion of the ankle. The nerve is deep fibular or perineal, L5 and S1. Extensor hallucis longus. The origin is the anterior shaft of the fibula. The insertion is the distal phalanx of great toe. 2 actions include extension of great toe at IP and MP joints. It also assists in dorsiflexion of the ankle. The nerve is deep fibular or perineal, L4 and 5. Peroneus tertius, also known as fibularis tertius. The origin is the distal fibula. The insertion is the base of the 5th metatarsal. 2 actions include eversion of the foot, and it also assists in dorsiflexion of the ankle. The nerve is deep fibular or perineal, L5 and S1. Peroneus longus, also known as fibularis longus. The origin is the head and lateral shaft of the fibula, upper 2/3. 2 insertions include the base of the first metatarsal on the plantar surface, as well as the medial cuneiform. 2 actions include eversion of the foot, and it also assists in plantar flexion of the ankle. The nerve is superficial, fibular, or perineal, L5 and S1. Peroneus brevis, also known as fibularis brevis. The origin is the lateral shaft of the fibula, the lower 2/3. The insertion is the base of the 5th metatarsal on the lateral surface. 2 actions include eversion of the foot, and it also assists in plantar flexion of the ankle. The nerve is superficial fibular or perineal, L5 and S1. Gastrocnemius. 2 origins, the medial head, the medial epicondyle of the femur. The lateral head, the lateral epicondyle of the femur. The insertion is the calcaneus via the calcaneal tendon. 2 actions include plantar flexion of the ankle, and it also assists in flexion of the knee. The nerve is tibial S1 and 2. Soleus. 2 origins include the soleal line of the tibia, as well as the posterior fibula. The insertion is the calcaneus via the calcaneal tendon. The action is plantar flexion of the ankle. The nerve is tibial S1 and 2. Tibialis posterior. The origin is the posterior tibia and fibula. Two insertions include the navicular as well as the adjacent tarsals and metatarsals on the plantar surface. Two actions include inversion, and it also assists in plantar flexion of the ankle. The nerve is tibial L4 and 5. Flexor digitorum longus. The origin is the posterior tibia. The insertion is the distal phalanges of 4 lateral toes on the plantar surface. 3 actions include flexion of 4 lateral toes at IP joints. It assists flexion of 4 lateral toes at MP joints, and it also assists in plantar flexion. The nerve is tibial S2 and 3. Flexor hallucis longus. The origin is the posterior fibula. The insertion is the distal phalanx of great toe on the plantar surface. 2 actions include flexion of the great toe at MP and IP joints. It also assists in plantar flexion of the ankle. The nerve is tibial S2 and 3. Popliteus. The origin is the lateral condyle of the femur. The insertion is the posterior proximal tibial shaft. The action, it initiates knee flexion to unlock the extended knee. The nerve is tibial L4, 5, and S1. Extensor digitorum brevis. The origin is the anterior calcaneus. The insertion is the extensor expansion of 4 medial toes. And the action, it assists extension of 4 medial toes at MP and IP joints. The nerve is deep fibular or perineal L5 and S1.